Okay, welcome back. Our next presentation is from Child and Adolescent Health Services, and I'm going to introduce Kendall first up to let you know about the programs on offer in CAHS. Thanks.
Good morning, everybody. Thank you for expressing interest in the Child and Adolescent Health Service program. I'm going to talk to you today about the different services that are under the Child and Adolescent Health Service. So our vision is healthy kids and healthy communities. Our objectives are to care for children, young people and their families. We want to provide high-value health care that values and respects our people. We collaborate with our key support partners and we promote teaching, training and research. Sorry, I think I've shut that off now, Nat. Our values are compassion, collaboration, equity, respect, excellence and accountability. I'd like to do an acknowledgement of country. I'd like to acknowledge the traditional custodians of our land, the Noongar Whadjuk people, and pay my respects to their elders, past, present and future. The Child and Adolescent Health Services comprises of community health, Child and Adolescent Mental Health Service, our neonatology and Perth Children's Hospital. We are all a part of the Western Australian Department of Health. I'd like to hand you over to Paula Miles, who is a nurse educator for community health. Thank you.
Hi everyone, I'm Paula Miles. I'm the clinical nurse manager for our community health program. So as previously, which one? The green one. Sorry. So as previously shown, community health sits under the umbrella of Child and Adolescent Health Service. Community health works within a model of progressive universalism where we provide universal support to all and provide more support to those who need it the most. At a primary prevention level, we develop health promotion and education strategies and provide early identification and intervention community-based services to children, adolescents, families to support the growth and development of healthy communities and school populations. Our nurses offer free health screening for every child from birth to school entry and provide parenting programs, drop-in sessions and more flexible ways of meeting the needs of our families. Additional targeted and specialty services are provided in Aboriginal health, refugee health, enhanced home visiting, children in care assessments and immunisation programs. We have over 150 sites across the metro areas, spanning from Two Rocks to Waroona, and ensure wide availability and easy access for our families. We're not a hospital and we work in a variety of community settings which include schools, child health centres, homes and immunisation clinics. So our program is a separate 12-month program. We usually recruit annually and start in February, although that could change for next year. Our graduates are allocated to a region and we work in a variety of community settings and services within that region. And what's different about our program is graduates will do a postgraduate certificate in partnership with Curtin University to study child health nursing. Our program perks, and I guess the most important thing is we don't do shift work. It's a Monday to Friday program with no weekends and no public holidays, so that's our program perk push. But, you know, obviously you don't get the shift penalties in that either, so you get a social life with not as much money to use it. Okay, so here are some responses from our nurses about what their role brings to our families. Because we know that what happens to children in their early years has consequences throughout their life course. Research has shown that the brain is most malleable during early childhood and that the environmental factors a child may be exposed to in this period can interact with their genetic makeup and have long life effects on both their brain development and physical development. This has enduring consequences for a child's future learning, behaviour and physical and mental health. It also affects their capacity and behaviour as adults across all areas of life, including employment, relationships and productivity. Therefore, services like community health that support healthy physical and mental development in children provide timely and effective intervention, which is vital for our society. Community health is committed to making primary prevention a health system priority The 2019 Sustainable Health Review report recognises and supports this priority in its recommendations, which seeks to drive a cultural shift to focus on prevention and community care supported by a modern, innovative hospital system. We're excited about these opportunities and what that might look like for future service delivery, making us well placed to be the future of healthcare. And we invite anyone to jump on board.
Hi everyone, my name's Robin. I'm here representing the CAMHS service. So Child and Adolescent Mental Health Service, we have 3 separate streams: Community CAMHS, Specialised CAMHS and the PCH Acute CAMHS. And the Mental Health Registered Nurse Graduate Program sits within the PCH Acute CAMHS stream. Many young people experience mental health issues. The majority of young mental health clients are seen within our community-based clinics. However, at times, some young people need more intensive specialised support. Acute and Specialised Services provides a range of specialised statewide mental health services for young people. And this includes, but not limited to, crisis intervention, mental health assessment, medical and psychological treatment, inpatient treatment, eating disorders, day program, education, training and support for families and young people. The dedicated mental health graduate registered nurse program is a unique opportunity for newly registered nurses to receive professional transition support in a specialised statewide child and adolescent mental health service. We offer a 52-week program that's in partnership with ECU. Graduates will enrol into the Masters of Clinical Nursing course, Mental Health Specialisation. You may exit after the year with a grad cert in clinical nursing with mental health. Recruitment through Grad Connect is in the normal intake. It's a 52-week full-time contract. There's formal study days at ECU. You have 10 supported supernumerary days within the acute inpatient unit, Ward 5A on PCH. We have excellent support from experienced mental health nurses and educators and opportunities for learning with scheduled monthly study days. The location of our program, as I said, is within the PCH Acute CAMHS stream. So it is a 12-month inpatient unit program on Ward 5A, and there's some pictures there of the 5A environment. There are opportunities to experience other CAMHS services. This includes community clinics, specialised and other acute services within PCH, for example, eating disorders service, emergency telehealth and gender diversity. Thank you.
Hi, my name is Deborah Mooney. I represent CAHS with the Neonatology graduate programme. Neonates joined CAHS in April last year when we had our first lot of graduates from the conjoined CAHS programme. Because of COVID, our graduates stayed for 12 months. Usually grads coming to neonates will stay 6 months, and the other 6 months will do another ward or clinical area in PCH. Just a few stats to start with. So all babies that are inborn at King Edward will stay in the special care nursery at the King Edward unit, which consists of 90 beds. Last year we had 6,000 births, and July was our busiest month with 600 births. So about 10% of them babies will come into the neonatal nursery, and babies born from about 22 weeks to post-term will be included in them numbers. Our second unit is at PCH, and that has 30 beds. And they more or less accommodate babies that are outborn from anywhere around the state. And any babies requiring specialist intervention with the paediatric team at PCH. Everyone's always interested in the classifications of different babies of gestation sizes. So any baby born less than 32 weeks gestation will go into the neonatal intensive care unit, okay, irrelevant of the size of the baby. So we might get a 32-week size baby, that's nice and big, that will go into the level 2 area, but you also may get a 32-week size baby that could be 1,000 grams. And you can see all the different definitions for maturity of the different babies. We get probably 2 babies less than 28 weeks per month come into the intensive care unit. And again, as I said, they come with all different diagnoses and problems. The majority will come with respiratory failure due to prematurity. So the way the lung development happens, some of them have still got 3 months of growth before the maturity dates, and they come to us at 28 weeks. They'll definitely require some respiratory intervention. And you can see on the picture there some yucky pictures of babies with cleft lip and palate, Pierre Robin, and a few other pictures. So the women that come to King Edward or deliver babies early or with issues are actually increasing. So you can see there's a massive list of contributing factors to why babies are born either sick or preterm. And there's 2 little babies there that require intensive care. People always ask about survival rates of premature babies. So the World Health Organization suggests that 20 weeks and 400 grams are the viable gestational ages, but we actually don't, in Western Australia, we don't resuscitate babies less than 22 weeks. And certainly that 22 to 23 weeks is a very, very critical period for whether we resuscitate or not. And certainly that's quite well influenced by what the families want us to do as well. You can see there at 22 weeks the survival rate's quite low. So we usually say about 25 to 30% of babies will die. 25% will be profoundly affected, handicapped, and then 50% will probably have some learning needs or will be completely normal. And we actually don't know which cohort will be the ones worst affected. And then you can see even 2 weeks later, the survival rate will jump up to 70%. So as I said, we work across 2 sites. So 90 beds at King Edward Hospital in the special care nursery. Again, mainly catering for preterm and sick babies. At PCH, we've 30 beds on 3B, and that has an absolute mixture of babies with lots of different speciality needs. Okay, and as I said, they get flown in from and transported from all around the state. So when grads come to us, they come for the first rotation or second rotation. And of course, we can't expect grads to just be able to go and look after babies and provide mums with education on breastfeeding and transitioning to home. So we have quite an in-depth, specialised education rotation to start with, involving some specialised study days, depending on what area they're working in. They'll start working in the lower acuity areas, so the babies that are just getting ready to go home. We're teaching parents how to feed and bath and care for their own babies using a FI care model, so that's a family integrated model. And then we'll actually rotate the graduates through to the step-down intensive care area, so they will look after babies requiring non-invasive ventilation, so CPAP and humidified high flow as well. And we do have a very successful transition to home. These twins were born at 25 weeks and were very, very tiny. And this mum actually comes to do some talks for our graduates and other staff now to talk about her journey. Them babies are about 2 now, and they went home quite successfully at 19 weeks.
And last but not least, we have got Perth Children's Hospital that makes up the final component of the Child and Adolescent Health Service. So we moved to Perth Children's Hospital in June of 2018. We are located on the QE2 site next to Sir Charles Gardner, and we're building a beautiful bridge over to Kings Park as we speak. We have got 274 inpatient beds that includes 6 beds from our Bentley adolescent unit, so those are for our CAMHS patients. We are the state's only paediatric trauma centre, and we do provide tertiary and key secondary health services, including our inpatient, ambulatory and our outpatient care. We are built around an ambulatory care model, promoting same-day care wherever possible. We've got our ward configurations here, so throughout your CAHS transition to practice program, you'll have lots of opportunities to rotate through medical and surgical ward areas. Currently, we do not rotate our graduate nurses through our paediatric critical care unit, but there are transition programs post your graduate program if that is an area that interests you. But you can work in general paediatrics, we can work in our adolescent medical and surgical area. We've also got our oncology, haematology, day treatment unit, emergency department and our outpatient centre. The aim of the CAHS Transition to Practice program is to develop and consolidate clinical skills for our beginner nurses. We want to familiarise our nurses with the hospital policies and procedures. We're going to promote personal self-confidence and development as well as coping skills, and we'll build your resilience while within our organisation. And we do want to develop a partnership which promotes teamwork between the staff member, the hospital and the community. In terms of our program structure, we are also a 12-month program, and we do offer 2 6-month rotations. When we do have a 12-month perioperative program if you have a particular interest in working in our theatre and post-anaesthetic care unit. We do a March and a September intake, and we are recruiting through Grad Nurse Connect annually, which will start in July of this year. Throughout our program, we offer a 5-day orientation program to start with. We then have our Strive forums that are monthly, so those are hourly education sessions every month, and the topics range from debriefs. We'll also offer guest speakers, case studies and simulations, and then we do offer full study days that run from 8 till 4:30, and you'll get 5 of those throughout the 12-month program. Our contract is 80 hours per fortnight, so this is 10 8-hour shifts across the 2-week period, and a reduction of hours may be negotiated with the program coordinator as well as the clinical nurse manager of each ward area. Our end result, so what we're looking for and striving for our CAHS Transition to Practice program is a confident and competent registered nurse. We'll provide you with a work history that has documented performance evaluations at the completion of your program. We want to build a foundation in the nursing care of children and their families, and we want to develop a firm relationship with the Child and Adolescent Health Service. We do also, we're a little bit biased, but want to keep you at the end of our program, so there will be employment and recruitment opportunities post the completion of the program. I am mindful of the time, so any questions that you guys do have, please come and visit us at our booth. You can't miss us. We're in the bright blue uniforms. We do have some information there for you and can speak to each of the nurse educators about a particular part of the program. Thank you.